We work a lot with aging brains. One of the signs and symptoms of having decreased brain function is brain fog. That's where you have a hard time with mental acuity and sharpness. Also, anxiety. If you have anxiety, that's a sign that the brain isn't working properly. There are things that we can do naturally to stimulate your brain to help with anxiety. Same as depression. That's a mood disorder. Our mood is in our frontal lobe. So there are frontal lobe activities and nutrition that we can use to help balance neurotransmitters so that we can resolve depression. Bowel or bladder dysfunction, constipation, diarrhea, memory issues, insomnia. A lot of times if you're in chronic pain, you have trouble sleeping. If you're in chronic pain, that's going to be poor brain function. So getting you out of pain is one of the first things that we need to do to calm your brain down so you can sleep. Slow movements. If your brain's slower, you're going to move slower. That's why old people are slow, and as our brain ages, we become slower with movement, slower with cognition, we have poor memory, we have more pain. I deal with pain every day with patients, and it's always the same story. I didn't have any of these pains, none of these pains once I became older. So one thing we all get to look forward to. And anosognosia, that's a symptom that you don't know that you don't have problems with memory or so. If I ask a patient if they have any sort of memory issues and they say no, and I ask the wife, and the wife's like, oh yeah, he's got a lot of memory issues, and then we know he doesn't even realize he has any sort of brain issues. So the different lobes of the brain, up here is the frontal lobe. Okay, that's where we have all of our planning, cognition, organization, and judgment. So if we were all disorganized, ADD, ADHD, that sort of thing. If we're having poor judgment as we age, sometimes we start making poor decisions. If our cognition is there, we're having trouble thinking, processing, remembering, that sort of thing. And our planning, if our planning's poor, then we know that we're having frontal lobe issues. Now the parietal lobe, that's where all the sensation comes in from the body. So again, if we're having neuropathy-like issues where we can't feel our feet, we have poor sensation, then we know that our parietal lobe isn't being stimulated as much as it possibly can. Now within the brain, the area of the feet and the genitals actually sit in the same area on the map of our brain, okay? So if we're having poor firing in our feet, then a lot of times that's going to cause some sort of erectile dysfunction or decreased libido because that area of the brain isn't getting stimulated properly. So if we have poor sensory input coming in, we could have other issues such as that too. So again, something we get to look forward to as we age. Vision is back here in the occipital lobe. Obviously our vision decreases as we age. And then in our temporal lobe, we have stuff like memory. So what happens? You start getting more forgetful as you age. Taste. Stuff doesn't taste as good as it used to. Your smell decreases or changes. And your sight. You have trouble with vision. So all those sort of things get processed. What am I looking at? That sort of thing in the temporal lobe. So that's why, you start losing your appetite because stuff doesn't taste the same, doesn't smell the same. Your hearing decreases, that's in the temporal lobe. So memory, that sort of thing. So if you're someone that has decreased brain function or a loved one that has decreased brain function, I hope this sheds some light on what needs done and what we need to do to fix that and get that brain firing as healthy as possible. So stuff like their ADD, ADHD goes away, stuff like their depression and mood issues go away, stuff like just their poor judgment, okay?